friends, myself Dr. Sachin Kurdan. Now we are discussing today about glaucoma. In a very simple way, glaucoma is characterized by progressive damage to optic nerve associated with raised intraocular pressure that is more than 21 mm of Hg. Normal intraocular pressure is 10 to 20 mm of Hg. Glaucoma is due to increased aqueous humor secretion or due to decreased aqueous humor outflow. It is imbalance between secretion and drainage. Now there are two types of glaucoma. First is chronic simple. This is also called as open angle glaucoma. Second is acute congestive or narrow angle glaucoma. There are two types: chronic simple or open angle glaucoma, acute congestive narrow angle glaucoma. Acute congestive narrow angle glaucoma, it is a medical emergency. Now, according to the mechanism of action, drugs classified into two types: the drugs decreasing secretion of aqueous humor and the drugs increasing outflow of aqueous humor. Aqueous secretion and drugs increasing aqueous outflow. Drugs decreasing aqueous secretion are beta blocker, alpha 2 agonist, carbonic anhydrase inhibitor. The beta blockers are two non-selective, selective. Non-selective acts on beta 1, beta 2. Selective, that is cardioselective, acts on beta 1. Non-selective are timolol, leobinolol, cartiolol. Cardioselective beta blockers are betaxolol, leobetaxolol. Alpha 2 agonist. These are selective alpha 2 agonists: apraclonidine, brimonidine. Carbonic anhydrase inhibitor, that is they inhibit the enzyme carbonic anhydrase in ciliary epithelium. Acetazolamide, brinzolamide, dorzolamide. And the drugs increasing aqueous outflow. There are two types of outflow: trabecular outflow and UV scleral outflow. The drugs increasing trabecular outflow are alpha 2 agonist and myotics. Alpha 2 agonists are, these are non-selective alpha 2 agonists, that is difeprin and adrenaline. Myotics are pilocarpine, physostigmine, ecothyroid. And the drugs increasing UV scleral outflow are prostaglandin analog, mainly latanoprost, bimatoprost, travoprost. Now we see one group, detail one by one group. First is beta blockers. There are two types: non-selective acts on beta 1 plus beta 2. Selective is also called a cardioselective, acts on beta 1. The non-selective drugs are timolol, leobinolol and cardiolol. Cardioselective beta blockers are betaxolol, levobitorxolol. These are the beta blockers are used in glaucoma. These are the first line drugs used in glaucoma. Now we see the ADR of beta blockers. Before that, mechanism of action. Beta blocker acts by decreasing aqueous secretion. This is the mechanism of action of beta blocker. Now we see the adverse drug effects of beta blockers. बीटा ब्लॉकर या नावातच त्याची ॲडव्हर्स ड्रग इफेक्ट्स आहेत. त्याच्यावर वेगळे ॲडव्हर्स ड्रग इफेक्ट्स लक्षात ठेवायची आवश्यकता नाही. दॅट इज बी. दिस बी इज फॉर allergic blephroconjunctivitis. This A for precipitation of asthma. This T for stinging. Burning in eye. Beta blockers, ADR, precipitate asthma, mainly non-selective beta blocker precipitate asthma, allergic blephroconjunctivitis, and stinging and burning in eye. Non-selective beta blockers are contraindicated in the contraindication of non-selective beta blocker. Just remember A, B, C, D. A for asthma, B for bradycardia or heart block, C for CCF, D for diabetes mellitus. In this four condition, non-selective beta blockers are contraindicated. But cardioselective beta blocker like betoxolol, levobitorxolol we can use, but cardioselective beta blockers are less efficacious. दूसरा ग्रुप आहे PGF2 alpha analog, that is prostaglandin analog. These are the drug of choice in primary open angle glaucoma. आता या नावातच याचे एडीआर आहे, तर ते बघू. P pigmentation of iris, G for growth of eyelashes, this F for fluid in macula, that is macular edema. PGF2 alpha. P for pigmentation of iris, G for growth of eyelashes, F for fluid in macula, that is macular edema. For 2 agonist, that is selective alpha 2 agonist. The drugs are acraclonidine, second is ब्रिमोनिडीन. आता यांचे एडीआर बघायचे, यांच्या नावातच यांचे एडीआर आहे. ए फॉर ॲलर्जिक, कंजंक्टिवाइटिस, lid retraction, this D for dry mouth, O for ocular allergy, this O for ocular allergy, Apraclonidine selective alpha 2 agonist, A for allergic conjunctivitis, LID, this LID is for lid retraction, and this O for ocular allergy, D for dry mouth. Same ब्रिमोनिडीनचा आहे. B for brain depression, it causes apnea in infants less than 2 years. So brimonidine is contraindicated in infants less than 2. This I for iridocyclitis, B for brain depression, I for iridocyclitis, and brimonidine produces apnea in infants less than 2 years, so it is contraindicated in infants less than 2 years. This is all about alpha 2 agonist, that is selective alpha 2 agonist. Anhydrase, inhibitor, drugs are acetazolamide, brinzolamide, dorzolamide. Acetazolamide is used orally, and these two are used topically. Carbonic anhydrase inhibitor. These drug inhibits the carbonic anhydrase enzyme present in ciliary epithelium. Acetazolamide used orally, brinzolamide and dorzolamide used topically. Now see the areas. This C for corneal edema, this B for bitter taste, This O for ocular allergy. And this drug acts by increasing uvoscleral outflow. This is the mechanism of action of carbonic anhydrase inhibitor. These are increasing uvoscleral outflow. Prostaglandin analogs. Drugs acts by decreasing aqueous secretion. This is all about. Then alpha 2 agonist, non-selective. Drugs are dipiviprin and adrenaline. Dipiviprin is a prodrug. Adrenaline do not cross corneal barrier, so we use dipiviprin, a prodrug. Now let's see the mechanism of action. Dipiviprin product crosses cornea, then it is converted into adrenaline. Then this adrenaline acts on beta receptor and increasing trabecular as well as uvoscleral outflow. At the same time, this adrenaline acts on alpha receptor, alpha 1 receptor, causes vasoconstriction. And alpha 2 receptor of ciliary epithelium. By decreasing aqueous formation. This is the mechanism of action of alpha 2 agonist non-selective. Dipiviprin prodrug converted into adrenaline. Adrenaline acts on beta receptor to increase trabecular outflow, uvoscleral outflow. And this adrenaline, that is, it is non-selective alpha 2 agonist, so it also acts on alpha 1 causes blood vessel vasoconstriction, alpha 2 act on alpha 2 receptor of ciliary epithelium, and these two action decreases aqueous formation. Adverse drug effects of adrenaline are redness in eye, and ocular allergy. These two are area of this. Next group is miotics. Drugs are pilocarpine, physostigmine, and ecothiophyte. Pilocarpine is directly acting cholinomimetic, and physostigmine is indirectly acting cholinomimetic. Pilocarpine is directly acting cholinomimetic, physostigmine is indirectly acting cholinomimetic. Pilocarpine is of short duration, so frequent dosage is required. Ecothiophyte and physostigmine of longer duration action, but the main drawback of ecothiophytes that is it accelerates cataract formation. So these drugs are not preferably used in glaucoma. Let's touch towards ADR. This S for stenosis, punctual stenosis of nasolacrimal duct. This C stands for cataract formation. Increasing trabecular outflow. This is the mechanism of action of miotics. Or narrow angle glaucoma. It is a medical emergency. Intraocular pressure remains normal till the attack of acute congestive glaucoma, and intraocular pressure is raised up to 40 to 50 mm of Hg. It is usually precipitated by use of mydriatics. Till the attack, before the attack of congestive glaucoma, patient is normal, but as soon as attack is precipitated, the patient complain of, that is, clinic sign and symptoms are severe headache, and redness of eye. Treatment of acute congestive glaucoma. First is hypertonic, mannitol 20%, glycerol. Hypertonic solution of mannitol 20%, glycerol 10% is used, and in some cases retention enema of glycerin 50% is also used. Due to osmotic action, mannitol and glycerol draws fluidiform ion into systemic circulation. Due to osmotic action, intraocular pressure is decreased. Second is acetazolamide. Acetazolamide is used IV or orally also. 0.5 gram acetazolamide is used IV to reduce the intraocular pressure. Third is pilocarpine. As soon as intraocular pressure is decreases, pilocarpine is start to use in 1 to 4% eye drop. Fourth is latanoprost, that is prostaglandin analog. Latanoprost 0.005% eye drop, or aprachloride 1%. Latanoprost 0.05% or aprachloride 1% eye drop are used. And next is topical beta blockers. That is timolol, (0.5% is used as eye drop. This is all about management of acute congestive glaucoma. These drugs are only used to turn the acute attack of glaucoma. The definitive treatment is only surgical or laser iridotomy. Surgical or laser iridotomy is the definitive treatment of acute congestive glaucoma. These drugs are only used to prevent or to terminate the acute attack, but the definitive treatment is surgical or laser iridotomy. This is all about of glaucoma. I hope you understand very well. Thank you so much.